Denise. Hey,
Progress.
Denise, just heads up. I could hear you clearly, but you were really quiet.
My word. Can you hear
I
me
don't
now?
know.
What's going on today?
That's better. Whatever you did, it's working.
Okay. Okay, I turned it up.
All
So
right.
let's see what happens. Okay, so all right, go ahead and kick us off.
Okay, well, I'll go ahead and take the honors. So my name is Wendy Dragoo. I am the LTSS claims educator for Anthem, and I'm joined today by my partners from United Healthcare and from Humana, and they'll of course introduce themselves at their various segments. So we're going to start today by just welcoming everybody and saying thank you for being with us today. What you are here for is the last of 3 training webinars for submission of test claims for LTSS pathways. So hopefully that's where you meant to be today, and that's what you've got with us. We did do 2 previous trainings on April 26th and 29th. Looks like we failed to update our date there on the cover here, but that's okay. Today's the 15th. And the previous sessions were pretty much the same. However, this 3rd session is focusing on phase 2 of testing. So there is some different content pertinent to just the different testing methodologies for phase 2 as opposed to phase 1. So we'll go ahead and move forward and we'll kind of get into the specifics of this testing. And for those of you who were a part of the previous seminars or had tested in phase 1, some of this will be a little repetitive to you, but bear with us as we do have some new attendees here today. So we'll start with the important announcement shared by the Office of Medicaid Policy and Planning that there would be emergency funding that was allocated for providers who experienced unexpected lack of payment after the go live on January 1st. So if there were, for example, unexpected outages or challenges in receiving your payments after the go live on July 1st for members in the Pathways program, the state has allocated funds for providers to access should they have those unexpected outages. Now, to be clear, this is not free money. This is forwarded funds that would be in future claims sort of deducted as takebacks as time went forward. But again, kind of recognizing that sometimes things happen that we're not prepared for or expecting. The state has put aside some funds for those providers should you need access to it. Part of qualifying for it, not the only criteria, so please make sure to read the bulletin very specifically. But part of that is that you participate in the testing of test claims. And we have, like I said previously, already closed testing phase 1, but we are about to prepare for testing phase 2. The bulletin itself is hyperlinked here, as well as additional information which can be found on the Pathways website, also hyperlinked here. And what we're going to cover today are just some of the general overarching guidelines for participating in this testing that are applicable to all of the MCEs. And of course, we're all here represented today. And then we will get into the specifics for the individual MCEs on how testing is functioning for their specific group. Okay. Yes, Miss Donna, you're good. So with that, I think I'll turn it over to Emily, is this your slide?
I I can take it.
Okay,
I don't know
awesome.
if Emily. Yeah, so let's talk about our testing timelines. So our initial registration started back in April 24th of this year. Our first testing session just wrapped up. That was until April 29th, until May 10th. And our second session is about to start. So all 3 MCEs are offering our portal in the second session and perhaps other things, I'm not sure. And we'll get into that later on in some slides. But our next session starts on Monday, May 20th, and will end, excuse me, May 31st. And I also want to point out that you can register until May 30th. So as long as you register with us and get those claims in for the first time by May 30th, you are good to go. Next slide.
Thank you so much. And yes, just to kind of cover some of the guidelines that are applicable to all of the MCEs for testing. We endeavored to try to put all of those criteria together that are applicable to all of us individually, so that it's a nice, easy place to capture it for you all. So first and foremost, this is the testing phase. We'll be using test membership. There is no real membership or PHI during the testing phase. So when you register for testing with each and or all of our MCE partners, you will be provided with test membership information to submit for your test claims. You will not be submitting real membership, excuse me. We are all inviting all in-network and out-of-network providers to participate in testing, so you do not need to be an in-network provider. You can be in the middle of a contracting session with one of the MCEs. It does not matter. We're inviting any and all providers who are seeking to work with Pathways in the future, Pathways membership in the future, to participate in testing. There will be no prior authorizations for claims testing. So we know that there are some services that do require prior authorizations in real life in production, and for the purpose of testing, that is a not requirement. So any fields that indicate prior authorization numbers, things like that, those are blanks. We are not requiring a PA for any sort of claims testing. Again, we had two claims testing periods, the first of which just wrapped up on the 10th, and the second of which will begin on Monday the 20th and go through the 31st. Test claim minimum. So there was a lot of questions about this leading up to and then throughout phase one. So this is highlighted in several slides for our deck here. And again, for those of you who've been a part of this before and you finally got the hang of it for what the minimums are, forgive us as we run through this again for our new members here. So I'm going to actually skip down to the provider claims first. So this is all of our home and community-based service providers. This includes independent physicians, this includes assisted living facilities, this includes a lot of different things, and we're going to indicate those on a slide here in the future. But our HCBS providers are required to submit 3 test claims to satisfy the claim minimums for as outlined by the state. Okay, so that one's a little bit more straightforward. The facilities, however, this includes our skilled nursing facilities. You're required to submit 10 claims for your locations. Now, where it gets complex is that we have a lot of large facility organizations, for example, that have lots and lots and lots of NPIs, right? So the way the state has identified and indicated what you are required to submit for your minimums is per TIN, okay? So if you have one single TIN and you have more than 2 NPIs or LPIs that operate beneath that TIN, you're only required to submit 10% of your NPI's claims data. Okay, again, we're going to talk about this a lot, so it'll come back up again. But if you have more than 1 TIN, think about your operation in terms of the number of TINs that you have. Okay, that's a lot. So we're going to cover it again, hopefully on another slide, just I think right after this one, where it's a bit of a visual to kind of help people walk through that. So this is an example for the minimums. So let's say that you have a single tax ID and you have 30 NPIs or LPIs that operate underneath that specific TIN. Okay. If this is you, if this describes you, click for me, please. You're only required to submit the minimum claim count for 10% of the 30 NPIs or LPIs. Okay. So instead of having to submit 10 or 3 claims for each of those 30, if you click again for me, please. 10% of the 30 NPIs or LPIs would be 3 providers, and then you would submit 10 claims for each of them for a total of 30 claims that you would submit. Okay, and then click again, please. And if you're a home and community-based service provider and you have 30 NPIs or LPIs operating underneath your TIN, you would select 10%, your favorite 10% of the 30 NPIs or LPIs, which would be 3. And you would submit 3 claims each. So total of 9 claims submitted for your single tax ID. And if you have more than 1 tax ID, you apply the same logic to them uniquely, individually. Okay. I see so many questions blowing up in the comments. So we'll circle back to this as we finish up the presentation and make sure this is crystal clear for everybody. Who counts as a home and community-based service provider? If you do not yet know if you are considered a home and community-based service provider, or if that's a new term for you, this runs down some of the provider types that are listed as home and community-based service providers. So whether or not you would qualify as having participated in the testing by submitting only 3 claims as opposed to the 10. If you're a facility environment, this hopefully provides that clarity for you. And then that's pretty much it, I think, for the overarching group as a whole. And then we will individually talk through some of the specifics for our various MCEs. And then as we're talking, I think we're probably all going to be working to answer some of the questions to the group at large in the chat, and wrap up with some answers to the whole group at the end as we come back together as a larger team. So specific to Anthem, so first and foremost, if you plan to test for the claims testing environment in phase 2, which starts on Monday, you have to register to test, okay? Now, if you have already registered for phase 1 or at some point in between phase 1 and 2 or over a weekend or what have you, if you have registered your NPIs, your LPIs, your TINs, everything that you would theoretically be submitting test claims for Anthem specifically, and I'll let the other 2 provider groups talk about what their requirements are, you do not need to register for testing in phase 2. Okay, I'm gonna say that again. If you've already registered and you did not submit test claims in phase 1, you do not need to re-register in phase 2 for Anthem. Okay, we have your registration and we will contact you. If you have already received test membership, but did not yet test in phase 1, you can use the same test membership for Anthem in phase 2. Okay, if you've registered but have not yet received test membership, we had a big surge of registrants come through towards the end of phase 1 that didn't make a ton of sense to anticipate them actually completing in phase 1. Then you will be given your test membership and your directions very shortly before the end of this week, so you know what to do come Monday and then through the balance of phase 2. Okay, there is no reason to re-register for Anthem. And if you have questions about your specific enrollment or your specific registration, our mailbox is there. You're more than welcome to shoot us a message directly and we'll answer any questions as they come through. So we're very, very excited to be offering electronic claim submission for phase 2 of testing. So phase 1 was a more manualized process that included a lot of what I'm going to use the term paper claims that were submitted to us electronically via email. And we will still continue to accept those claim form types. So if you are a provider group that would like to submit in your claim files on a 1500 or a UB04 form, you're welcome to do that. You are also still welcome to submit them to us via email in a DAT form or in TXT format. You can still do that. Anything that was acceptable in phase 1 is also acceptable in phase 2. However, we anticipated that a lot of providers were waiting for phase 2 because of the option to submit directly into Availity's EBI. Okay, so if you have not yet registered for Availity, please do so as soon as possible. They are being inundated with registration at this point. So if you have not yet done so and registered with Availity, please make sure to do so before the end of the day to make sure you are set up to test successfully in next week. You can do so by clicking the link in this on this slide number 9 here for Anthem specifically. That'll just take you to the Availity Essentials website to register. Customer support for Availity, their phone number is listed there. If you can log into Availity, if you've gotten to that point of your registration with Availity, you will also have access to a chat function, which is actually really helpful. So if you have questions about general navigation or, am I set up for success come next week? We would direct you to the Availity customer support team, and you can either access them by phone if you cannot log into Availity, or through the chat function if you're logged into Availity. Okay. I'm going to go back up here just a touch here and just highlight several questions that came through in phase 1 about phase 2. So yes, you can certainly submit an X12837 transaction for your claim types for phase 2. We will be providing a specialized payer ID for the purpose of testing in phase 2. So while you're going to see on the next slide here, our live and production payer IDs here in just a moment, there will be a specific one for testing that we will provide to you via email after registration, okay? You can enter your claim information directly into Availity. If you have not yet used Availity, it is very user-friendly and it is very simple to navigate. I see some of my colleagues shaking their head. I can attest as a former provider person that is absolutely the case. It's really easy to use, and they have a really, really good set of library content just for how to use different functions of the system. There's a really great 8-minute video for claim submission, and I'm going to link it in all of our registration emails moving forward. So if you have questions specific to how do I submit a claim, that's the first place we're going to direct you to go, because it's specific to Availity and it's going to walk you through the process in a really step-by-step format. Okay. Okay, next slide, please. So claim submission for Anthem, again, specifically, we're going to need you to use dates of service that are from January 1st of this year to current. So they cannot be future dated. They will deny in the testing environment. So you can't do anything beyond the first date of service, which would theoretically be Monday the 20th. And then if you're submitting on the 21st, you can do the 21st. So it has to be 1/1/24 to current. Anything before 1/1 of 24 will also deny. So just make sure you're operating within that window of time. Our EDI for both for professional, institutional are listed here for you. This is for production. So again, these are payer IDs that you should already have for any of the other Anthem lines of business that you may already be working with, but they are not applicable to the testing environment, okay? So that will be provided to you via email, okay? Hoosier Care Connect enrolled providers. So Anthem is offering the opportunity for those providers, if you have sufficient production claims from 2023 to current, that we could rerun those through the testing environment after we de-identify the information in there, rather than you submitting your own new test membership claims for the testing purposes. So if that applies to you, if you are a currently enrolled HCC provider and you believe that you have sufficient membership claim data from 2023 to current that you would like us to reprocess on your behalf, please make sure that you're registered, just like you would need to be if you were submitting new claims for us. And then also just follow that up with a quick email to that same mailbox and say, we would like to see if we have sufficient test membership data for HCC, okay? And we'll look into it for you and we'll work with you directly. And then again, that test patient data, we are not using real patient information. So again, everything is de-identified, even back to that HCC component, if that applies to you. Okay, next slide, please. So how to follow up and kind of what to expect on a timeline purpose. So I will pause here for just a moment and just sort of underscore that phase 1 of testing, while we know it was quite manual for our providers, and we really appreciate and respect all of the work that was put into that effort for phase 1 of testing, it is quite also manual on our side of things as well. So we are still working through the massive amount of submissions that we have received. If you have not yet received any communication back on the status of your first submission, whether or not you passed, do I need to participate in phase 2? Please know that we are working to get back to you as soon as we can. And just to underscore and reiterate that your participation window was obviously closed on the 10th. However, if you submitted your claims before the 10th, then we can work through any challenges beyond the 10th and you will still be satisfying the participation requirement, okay? If you have to participate in phase 2, or even if you choose to work in phase 2, you're welcome to do so. And again, if we have to work with you to ensure you get to that end goal of green light, pass claims are all good to go, you pass the environment, beyond the window of time that's set out beyond the 31st, then we have that time to do that, okay? So as long as you submit your claims in before the end of the testing periods, then we have as much time as we need to ensure that you get the green light, okay? That all being said, here's what we are endeavoring to hold to from Anthem's perspective of communication to our providers. So of course, you're all going to get feedback on whether your claims were accepted, rejected, if we had technical issues, if they were denied, or if you passed the testing environment. We're here to offer you any sort of technical assistance or ask you questions or answer questions that you may have. And then of course, once we actually receive your test claims all the way through the process, and there's provider education that we can communicate back to you, we are here to do that as well. Especially in phase 2, if you have registered and we have not yet seen your test claims come through towards the end of the testing period, we will do outreach to you and ensure that you are having everything that you need to be successful and that you meet that deadline for the submission. Again, the results portion of things beyond the testing window environment, we have more time. So we just need to make sure that you have submitted in clean-ish claims that we can work with and work with you with before the end of that testing period. So hopefully that's helpful. And next slide, please. So just how to get in touch with us. If you need to do so, you're more than welcome to contact us in the claims testing mailbox. I think everybody probably has this email. It's monitored by a team of individuals, but most likely if you've been communicating with somebody in that email format, then you've been talking to me. So my email address is out there as well. You can message me directly, or certainly you can use this shared mailbox. If you have questions that are specific, not necessarily to the claims testing process, but to LTSS pathways for aging for Anthem, we would direct your inquiries to the provider relations mailbox, which is listed here as well. And next slide, please. Thank you. And we're also offering lots of go live support, including providers are assigned a local dedicated provider relationship management representative. This is a team of individuals that are geographically assigned to providers across the state. If you do not yet know who your representative is, please outreach to Ryan Fennessy. His email address is down at the bottom of this slide, and he'll make sure to put you in touch with your individual representative. And if you've been working with them and you need to get additional support or not quite sure where to go, again, please contact Ryan. We're also holding bi-weekly office hours, which we had one today. We had a really great turnout, lots of good conversation and questions happening. If you would like to register for that or for any upcoming additional LTSS provider webinars, I would again direct you over to Mr. Ryan Fennessy. His mailbox is listed down below, and he will make sure that you have any links and registrations that you need to participate in those sessions. Next slide, please. And then finally, we just have our points of contact here for various segments. So again, myself, I'm the claims educator. Of course, right now, really working through this testing environment, but come go live. And once we have production claims, I'll be your point of contact just to answer questions about claims and where things are. We, of course, have your provider training specialist, Ryan Fennessy, our value-based programs specialist, Ms. Haley Osborne, and our contracting network specialist for the home and community-based service providers, April Walton. All of our contact points are there, and I was told that my phone number on this slide deck is not quite right. So we're going to update that for you, and I'll make sure that the deck that gets posted has that corrected, and I will also drop it into the chat. So if you need to contact me directly, you have every way to do so. And then, of course, our website for just the pathways for aging with Anthem. And then our provider relations map is posted here as well. Again, we are onboarding and adding new team members constantly. So this map is being updated. And if you're not sure who your PR person is, it's very possible that that's been updated recently. So please check the map and make sure that you have that up-to-date information. I think that's it for Anthem.
All right, thank you, Wendy. So next, let's talk about the Humana Healthy Horizons process. Can you all hear me? So Wendy, Amanda, can you hear me? Okay, good deal. So just as a recap, as Wendy said, round one has ended. So round one ended on May 10th for Humana Healthy Horizons. It ended on May 10th, last Friday. And the email box that providers were sending emails to prior to that, that mailbox was turned out. So you probably received an automatic response saying that round one had ended. and to resubmit your information for round 2. As this was also said, and I'm gonna have to kind of navigate this because the way I'm sharing my screen is kind of choppy. So just so you know, again, it's another recap for providers who do not participate in this time frames. You will not be permitted to test after the 31st. So again, round 2 starts on May 20th and ends May 31st. All right, and so for Humana Healthy Horizons, it's just an overview of what Wendy was saying earlier about the amount of claims by specialty that needs to be submitted. Again, we are not testing for prior authorization. And in addition to round 1, now in round 2 for Humana Healthy Horizons, you can also submit through our provider portal. So let's get to the registration process. So starting today at 5 p.m. Eastern, again, it's starting today at 5 p.m. Eastern, we are opening the round 2 registration. For round 2, you will be able to submit for paper, A37, the CMS 1500 or UB04. We will be providing that fillable form again in round 2. And again, newly added now is the provider portal testing environment. Again, you will need to submit your request, but again, I want to say this again, it doesn't start until today at 5 p.m. Eastern Standard Time. And so if you submit an email prior to that, you will receive that round 1 has ended and you will have to resubmit. So I'm going to encourage all to not send an email to our email box until 5 p.m. Eastern Standard today. And it's, again, will end when round 2 ends on May the 31st. After submitting the request, the registration request to our provider testing email, same as round 1, you will receive an automatic reply from the Indiana Medicaid provider testing email box. So please check your spam if you haven't, if you don't see anything shortly after sending that email. Now for the provider portal testing environment, for those that would like to, participate in the provider portal testing, and testing in the provider portal in our testing environment, we are encouraging you to register now, starting at 5 o'clock today through May 20th. The registration process for our provider portal testing environment, which is Ability. Let me just say that it is the Ability provider portal testing that Humana will be using. It is a process. So you will have to send an email letting us know that you want to participate in the testing. And then in that automatic response, and I'll highlight this on the next slide or so, similar to round 1, we're going to provide a provider testing link. And then you would need to click on this link and then start that registration process for the Ability provider portal testing environment. Now, just as a side note, and I thought I would mention this because during round 1, I had conversation with a few providers, and this information was shared that there were a few clearinghouses or and EDI vendors that did not want to participate in the testing. And as a result, those providers had to submit an electronic claim or an A37 file, which is fine. We will accept both. But I am encouraging you all, before initiating the registration process for Ability, if you could give your clearinghouse or your EDI vendor a quick call just to confirm that they are willing to participate of testing claims in the Ability testing environment. So I just want to stress that. And just so you know, if your clearinghouse, as it says here, if your clearinghouse or your EDI vendor declines to participate, do not worry. You will still have the option that was offered in round one, which was submitting a paper claim, and our PO box is listed on another slide. An electric claim, you can send that to us, as well as the 837 file. So again, I just wanted to highlight that and just ask or encourage you all to just check with your clearinghouse. Just give them a quick call prior to initiating the registration for the Availability Provider portal testing environment. And please stress to your clearinghouse and vendor that it is the testing environment. I was about to say next slide, but I am next slide. Okay, that's a bad habit. Okay, so again, for round one, we offered calls on Tuesday, Wednesdays, and Thursdays. We're offering those same calls again. Tuesday, Wednesdays, and Thursdays, starting May 21st, going until May 30th from 8 a.m. to 9 a.m. Our first call takes place next Tuesday. The link is here. I would encourage you to call in. Round one, the calls that were well attended, good conversation. And again, if you have any questions or concerns, you can call in and ask your questions, and we will either answer them there, or we will follow up with a phone call or an email to you. For general questions or concerns, again, I'm asking that you send an email to the email address listed here, but in the subject line, I'm asking you to please indicate that this is for the provider claims testing for round two, because as you know, we have a lot of emails that will be coming into the email box for round two testing, and we want to be able to identify any email that's coming through with a question or concern. So in the subject field, if you could put provider claims testing round two, your provider name, provider, and your provider tax ID, that would be very helpful with us getting back to you quickly. All right, as mentioned earlier, we're still offering paper claim submission. Here is our PO box for our paper claims, as well as our payer ID. And this rule still stands as it did in round one. Please do not send PHI. We will provide member test information. That member test information will be provided to you. The dates of service that you will need to use is 1/1/2024 through April 20th of 2024. Again, you will either receive an email congratulating you, or you will receive a phone call to discuss claims that have denied. Also, I want to mention a few things here while we're at this dot point. We are still reviewing some claims, a handful of claims that were submitted in round one. So if you have not received a call, please do not worry, do not panic. You will be receiving a call. We are still working through those. So if you submitted claims during round one, please bear with us. You will receive a follow-up. In addition to that, if you participated in round one, if you registered and submitted a claim during round one, if you registered and submitted the minimum requirement, so if you met the requirement for claim submission during round one, you do not have to participate in round two. Again, if you registered and submitted claims and all went well, if you're waiting to hear back from us, you do not have to submit a claim for round two. Again, you don't have to. If you do, we'll accept it, but just wanted to let you know, if you completed the task in round one, you do not have to participate in round two. Also, I just wanted to put this reminder out there now that we're moving into the provider portal testing environment, that we offer ability overview training webinars. And I have attached the link to our Q2 training calendar where you can sign up for ability training. As Wendy mentioned earlier, ability is a very easy to use tool. However, these webinars that we host, it allows, for dialogue. So it allows for us to walk through the process as well as open the opportunity for you to ask any questions or concerns you may have. All right, and that is it for Humana, and I will hand it off to Amanda with United.
Thank you. Okay, there we go. All right, next slide. Thank you. So to register for round 2, or if this is your first round, that's fine too. You simply just email inclaimstesting@uhc.com. This will start a process, what we refer to as the registration process. If you can, when you first email us, I don't know if you can take a screenshot of this, but if you can't, that's okay. If you could include your agency or organization name, a contact name, and an email address if it's different than the email address you're using, tax ID, your NPI or Medicaid ID, your testing method. So that could either be electronic paper or portal. And if you're contracted or non-contracted. So if that information could be included in the initial email, it might make it go a little bit faster, but if not, that's okay. We will send you what we call a registration form. And that registration form basically is going to ask for the same information. Next slide. So in round 2, all 3 of our testing options are available. So you can submit paper claims through email. And that has been the majority of our claims that we've received so far. So we just ask that you most definitely do not use PHI. If you do not have any UHC test members, we can supply those for you. Or if you've already done testing with us, let's say you've submitted paper and now you want to use the portal, you can use the same test members. You can also go through oh, I'm sorry, this is about, sorry, this is about paper claims. So make sure that you populate all the required claims data that Gainwell requires. I know there's been a lot of questions around what information do I put in which box, and I believe either Bria or Haley may have put the link in the chat earlier. But I will say that it's very important that in box, if you're filling out a CMS 1500, in box 33, you're putting in what's referred to as your enrolled service location. So it's not billing, it's not mailing, it's your service location. And you would have registered that with OMPP when you first went into the Medicaid program. Also make sure that you're filling out the dates of service, making sure you're including all of the appropriate modifiers. And once you have done that, you can email that claim form to inclaimstesting@uhc.com. Yes, I can repeat about box 33. So box 33 is kind of like if you're looking at the CMS claim form, it's on the bottom right-hand side. And in box 33, it's an Indiana Medicaid rule that you put the enrolled service location. So that would have been the location where either if you actually see patients, or most providers don't actually have, HCBS providers have members coming to them, right? You go to them. So that would just be your enrolled service location. So if you're not familiar with that, just please let the MCEs know. We can help you with that and just help you distinguish between the different addresses that are available. And again, at least for UHC, that's only applicable if you're doing the mailing or the email of the paper claim, and we'll touch on the portal here in a moment. So next slide. So testing options with EDI. So basically the testing option with EDI is for the 837 837P or 837I file that is created by your clearinghouse is sent to us. So we have had some successful EDI claims come through. So if you're one of those providers, thank you for giving that a shot and working with us to get that to us. So basically how this works is you bill the claim through your system. You would use our 87726 payer ID, and then you would have to indicate a T in the ISA15 indicator field. And if this sounds completely foreign to you, maybe EDI is not the right option. But if you're familiar with EDI or clearinghouse billing, then this is the instructions on how to do that. So once you're able to bill the claim through the 87726 with your T indicator, if you go out to your clearinghouse and download your X12837P or X12837I file, you can email that to Shelly Phillips at optum.com, including your tenant organization name. And there's some other instructions here, but anyway, Shelly Phillips will take that file and will upload it through our Optum Insight Clearinghouse. So we can see once the clearinghouse receives the claims, how those claims process. So next slide. Okay, so our portal option will be available on Monday, 5/20. So any provider who would like to either has already registered with us and has indicated that they want to bill through the portal, or they have submitted to us newly a request to bill through the portal, or you're going to submit one this week, we ask that you allow us to reply back to you with the appropriate link. So you will get a link, and within that link, it'll take you to a screen where you can create your testing one healthcare ID. Not to be confused with an Ohio ID like I did. So when you live next door to Ohio, sometimes that can get a little confusing. So you will create a one healthcare ID for the testing environment. It's super simple. You just need your tax ID and a couple other pieces of information, and you will have that one healthcare ID created. And then once you have the one healthcare ID, then you'll be able to go on and follow those instructions for the portal. I will say that when you're using our United Healthcare portal, you know, all of that information about Box 33 and what to, oops, 1 second. Shoot. Okay, can you hear me now? Okay, somehow I got muted. That was weird. Where was I? Okay, so once you're in the portal, you will. I think we're having some technical difficulties. So once you're in the portal, you'll have a series of drop-down boxes that you'll pick, and our system feeds that information into the portal. So it'll be pretty easy and familiar with you based on the Gainwell portal to know, you know, what to pick through in those boxes. So hopefully that will be a help. But again, we are here to help you navigate through that process. This is a new portal for every provider. Well, maybe not every provider, but for at least for the HCBS providers. So again, we're more than willing in here to help. So next slide. Okay, so let's go on to frequently asked questions. Denise, did you want to kick that off? Because I think I'm having some microphone technical issues.
Okay, can you hear me?
Yes.
Yeah, so that's why I put my hands up here. So I was like, I hope I'm not hitting something. So frequently asked questions, and Wendy, feel free to chime in, and so we can get through these. Do I have to test in both windows or just one? So that goes back to, if you tested in round one, you do not have to test in round two. So Wendy, Amanda, your thoughts? And that was for Humana. If you tested in round one, you do not have to test in round two.
Yep, and we're
All
all
right.
concurring with that. If you tested and you tested with the minimum required claim counts for your specific provider type, then you are good for Anthem as well.
Yes, and that's
So,
correct for
yes.
United as well.
Okay. Thank you. And so, Wendy, because you walked through this so well, I'm going to jump down because the second one talked about the 3 webinars. And since this is the last webinar,
Yeah.
can you please clarify the 3 versus 10 claim rule? And I think I saw a few questions about that.
We did. Yes, we still have some questions coming through on that as well. So if it's possible, I think the visual is really helpful. Do you mind terribly scrolling back up to that slide, Miss Denise?
Okay, hold on.
I know
Give
it's
me a
on,
second.
it's written
I
out
know.
here in your frequently asked questions. So if you wanted to
Okay.
look at that after the fact, that's helpful. But I
No,
think
but everyone just close your eyes. I tell
just
you what, hold on. Hold on. I'll
you
do
get
this.
seasick with all that. No, no, no.
Yeah, give me 2 seconds, everybody.
You're
2
good. You're
seconds.
good.
Because that slide was helpful. So let me get back to, here it is.
And while you're
Slide 5.
getting that up, I see a lot of folks asking for a printable version or the copy of this deck. And I know that that has been dropped in the chat a couple of times by our folks here. So it'll be available on the IHCP provider resources website. Immediately after our presentation here today, this information, the recording, everything goes directly to the state, and then it's up to them to post it. So if that happens before the end of this week or by the end of the day, that's really, on their timeline. But yes, it will be available and accessible to you. And the previous webinars are already posted up and you can have access to them already. Okay, so testing minimums explained again. So think about your individual practice for just a moment and how you are registered for tax purposes, okay? Most of the questions that I'm getting, and hopefully my colleagues can correct me if they're getting different kinds of questions, but most of the organizations that have questions about the minimums are coming from organizations that have a single tax ID. Okay, so we're going to start there because it's the simplest of the not so simple things. So you have a single tax ID, and if you have a single LPI or NPI that operates underneath that, if you are a facility, you're going to submit 10 claims. Okay, if you're a home and community-based service provider, so let's say a waiver provider, you're going to submit 3 claims and you're done. Okay, that's the simplest of all of the scenarios. You have a single tax ID and more than one NPI or LPI that operates underneath that. Okay, so let's say you are a home health care provider with a single tax ID that covers the whole state of Indiana, and you have 5 branches. Let's make it more complicated. Let's say you have 13 branches. Okay, so you have lots of branches across the state, and all of them operate under different NPIs and LPIs under the same tax ID. Okay, you're going to register them all if you have not done so. Okay. And then you only have to submit for the state minimum requirements 10% of those 13 NPI or LPI locations. Okay. So you get to pick your favorites. And if you don't have favorites because you're a good mom, then we'll pick for you. And we'll pick 2 of the 13 because that's 10% equivalent of the 13. And you'll submit either 10 claims each or 3 claims each for those 2. And I can't speak to how my colleagues at the other MCEs are identifying this, but when you get test membership from Anthem specifically, and you have lots and lots of NPIs or LPIs enrolled, and we're identifying a 10% minimum for you and providing you with test membership to support the test claim minimums, we're indicating which of those locations we've selected on your behalf. Okay. So I know that was so much, but you can get as many NPIs or LPIs under that single tax ID as possible. You can have 200 of them, and you're going to select 10% of them. And you have to submit test claim data for the 10% that operate under that single tax ID. Now, if you're a very complex organization and you have more than one tax ID to think about, I have had several organizations, for example, that are large facilities that have a tax ID and a TIN that operate underneath, and then another location will have a different tax ID and a different NPI LPI that operates underneath, and that happens across the whole state of Indiana. So if that's you, if you have lots of locations and they're all affiliated with different tax IDs, the way that the state wrote the bulletin for participation requirements, you have to submit for each of them individually. You treat each tax ID as its own operation. Okay. So hopefully that was helpful. I'm not seeing a lot of questions in there about that.
And while you're doing that, Wendy, I'm gonna pause and go back to the FAQ slide. So
Thank you. Lots of questions again. If you participated in phase 1 of testing, you do not need to participate in phase 2 of testing to satisfy the requirements set forth by the state. However, you are more than welcome to do so if you would like to test in the EDI environment, in the availability environment, in the electronic claim submission environment for UHC, and you didn't take advantage of that during phase 1. I mean, any scenario, if you would like to test in phase 2, you're welcome to do so, but you are not required to do so based on the state requirements. I'll just keep going, I guess. Can we test even if we're not fully participating yet? Yes, you sure can.
Yes.
So this is open to any and all providers who would like to test for pathways. Absolutely.
And then there was a question that I keep seeing about having to test with all 3 MCEs, and the
Yeah.
answer to that is yes, you have to test with all 3 of us. What is it? I registered. Okay, let's go to, do you see anything else that we haven't addressed, Wendy or Amanda?
I don't think so
Or
on
can I go
here,
to the
no.
next? Okay.
That question I think keeps coming up about
Yeah.
the individual. So imagine again, while we are working together here in this format, and of course we're helping each other, the different MCEs, we are unique and standalone, of course.
Yes.
So the testing to ensure that the communication pathways of the systems, of your claims data, everything between each of our different groups is required for sure. We wouldn't want to say that you did successful testing if testing with Anthem failed, but you were successful with the other 2, because then guess what? When we're in production, you're not getting and we're not receiving claims information on your behalf. So yes, you have to participate for all 3. Absolutely.
And we did just get a question in the chat, and I think we've had this question before. Will all 3 MCEs use the same test members?
Oh, that's a good, yeah.
No,
Good.
we have different test members because we have different requirements to set up members within our systems. So unfortunately, we have different. So we will provide you the test members you can use for the 3 MCEs once you've registered with us. Each MCE will provide that for you. I'm sorry.
And not only will we provide, each MCE will provide their own test members. For example, Humana received the testing form for UHC. So not only do we have our own test members, our own testing process, we also have our own registration form. So unfortunately, if you send Humana's registration form to Anthem or United, they will not be able to accept it. So you have to use the registration, or you have to follow the registration process that each MCE has outlined. Again, as Wendy and Amanda were saying, we have a similar but not the same process because we have a different set of test members, as well as our registration form looks a little different. And so we did receive a registration form for you, Amanda, and we had to respond to a few providers just to let them know that we were unable to accept it. So I just wanted to call that out.
Yeah, and we had that as well. We had some folks submit their claims data to us that actually were meant for other organizations. So again, just to reiterate, we are working together here. We are we're sharing information with folks. Now, I can't submit your test claims on your behalf to Denise or Amanda, but we're communicating and saying, hey, I got somebody reached out to me and I think they meant, for you. And we're letting, of course, our providers know. So just kind of be on the lookout for that, because that has happened a couple of times. I'm seeing some questions. Oh, I'm sorry, please go ahead.
Oh, sorry. 2 more questions I wanted to address. Specifically for UHC, if you have, I saw this question, if you have tested with us in round one and you want to test it with us in round two, you can use the same members. I think towards the end of this, or in the last week and a half, we've been giving a pretty large list of members to choose from. So yeah, you can still choose to use any of those members. And then the second thing, I keep seeing this pop up, are you required to test? Please know that you are not required to test. If you want to test with us, it's either to make sure that you are, you know, getting yourself in the fictitious line of, you know, needing financial assistance in the future. So all three MCEs are working to make sure that that is never needed, and we don't anticipate that, but it's a safety net. And so if you feel like your organization requires that safety net to get through this new transition, then we encourage you to test. And then it's also for peace of mind. You know, if you're currently, I'll just use United, for example. If you're currently billing United Healthcare today for another line of business, not much is going to change. So if you're comfortable with that billing and you're in a position where you don't feel like you need that safety net, then no, you're not required to test. So just wanted to reiterate that.
Absolutely.
Good call out, Amanda. Thank you.
I saw the question in the chat as well. So again, just to high level confirm, so for electronic claim submission, Anthem and Humana use Availity. And I see people asking specifically about Care Central, which is a functionality within Availity for Anthem specifically. So I'm going to ask you to just take that word out of your mouth for just a moment for the purpose of this conversation. So if you want to submit test claims or know where real claims will live after 7/1 for Anthem and for Humana, the system is called Availity. Okay. UHC has its own system, the One Healthcare portal, and the details surrounding that are in their portions of the slide content. Okay. Testing phase 2 for all MCEs opens on Monday the 20th. I saw that question as well. That is not specific to an individual MCE. That is for all of us. So you can't submit test claims today, but starting on Tuesday of next week and running through the 31st. That's your window.
And so Wendy, maybe that's speaking to for Humana. We're asking those individuals that want to register for our testing portal, that we're opening up that email at 5 p.m. today for you all to send an email to, you know, letting us know that you want to participate in the provider testing portal. And so I can you know, share it's the Humana Healthy Horizons Indiana claims. Let me just pause and go back. Because again, that opens up at 5 o'clock. So maybe that's what the person is referring to. Wendy, I'm not 100% sure, but we will open for hold on, this is it. I'm trying to, my screen setup is a little.
You are doing a great job, Miss Denise.
Thank you, Miss. Okay, so maybe this is what the person is referring to for Humana. For those individuals that are wanting, what I said was for those individuals that are wanting to participate in the provider portal testing, we're opening it up at 5 p.m. Eastern, and we are encouraging those providers to start that registration process starting today through Monday, the 20th. As I said earlier, that registration process for our testing environment, it is a process. However, when you click on that provider test link, we're going to provide step-by-step instructions on how to register. But again, because it's a process, so we wanted to get it started early to give to give those providers that want to participate in the portal registration the opportunity to do so, as well as for us to have the opportunity to review the claims, process them, and follow up with you. So I hope that helps.
Another question that I saw several times in the chat, and then I know we're here at time, so perhaps this is our last one, I'm not sure. If you're already a provider that works with any or all of the MCEs for other lines of business. So let's say you work with Humana for commercial policies. You work with United Healthcare for Medicare replacement. You work with Anthem for HIP, any and all, right? Do you have to test? Again, there is no requirement to test. This is per the bulletin that the state put out. Testing is required if you would like to be eligible for this future funding, if you need it in the event of sort of an emergency situation where payments are not occurring as they should, as expected. The bulletin is in this slide deck. The bulletin is, of course, on the IHCP website. We would encourage you to read the specifics of that bulletin very carefully to make sure that you are meeting all of the criteria, not just the testing criteria. I know it's been dropped in the chat a couple of times already as well. So, please definitely reference that. And if you are an enrolled provider for any of our groups, for any lines of business at all, that does not qualify you for having met the testing criteria, because this is a new line of business for all three of us, the Pathways program, okay? So the state is effectively encouraging our providers who will be Pathways providers to make sure that claims communication systems between each of the MCEs are functional before we go live on 7/1, okay?
All right, and with that, as you said, we are a few minutes after. We thank you all for joining this call. We will get this slide deck as well as the recording over to our FSSA partners so they can post it on their website. And with that, Wendy, Amanda, thank you so much for partnering with us. This is our last webinar for the testing calls. However, as we mentioned earlier, there are ways to contact us. We all will be hosting forums and sessions where you can call in or call us to ask questions or address any concerns. So with that, you all have a wonderful, wonderful day. And I guess we'll be talking to you next week.
Thank you.
Take care.